Congress really doesn't care about physician opinions. They're dismissive of us. But our patients' voices matter because our patients are innumerable, and they are the voters.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, I've just been thinking we got a lot of stuff to talk about when it comes to dermatology and the leadership of dermatology, right? This is a topic that I think we've wanted to talk about, but we're finally getting to it.
Oh, absolutely. We are a field within the House of Medicine and within all of healthcare, essentially, and all our practitioners, be it in Western medicine, integrative medicine as a whole, we all have to advocate for ourselves so we can take better care of our patients. And some folks in our community really dedicate a career to doing that, which is quite astonishing. I think a lot of times we think about it in the frame of politics and it has like a negative connotation, but within medicine, we've had a few leaders come to our program and it's always these amazing special people who dedicate themselves to try to help advance healthcare for our patients. And today we have a special guest to talk about all these topics. We went in the pre-show, we talked a lot about different things. I think our list is really packed with items to talk about, but let's introduce our mystery guest.
Absolutely. We get lucky as dermatologists, to have the American Academy of Dermatology represent us as a society, and it's the largest dermatological society. And we have Dr. Terry Cronin, who is the current president of the AAD, and he's in the 2023 to 2024 term. He's also a practicing dermatologist, so he knows exactly what we're facing on the ground. He's in private practice in Melbourne, Florida, and he's from the University of Miami family. So I know that's a way of both of you to connect. So Terry, welcome to the podcast. We're excited to talk to you.
Well, it's a real honor. I've never had such a great introduction, guys. Thank you so much.
Oh, yeah. We try to keep it short and to the point about the important stuff because you not only part of the UM family, you practice within your family. And so I know that dermatology is very personal to you, but maybe you can share with our listeners what made you go from, seeing patients, which is pretty impactful, right, to decide I'm going to take it to the next level and get into leadership.
Well, that's a great question. So my father is a dermatologist. So dermatology is kind of like a lifestyle. I kind of grew up watching him as a role model and went to medical school thinking that, there's got to be something better than something my dad does. When I got there, I found that there was nothing better than dermatology. Dermatology was, the wonderful, most amazing aspect of medicine because we could do everything, whether it was surgery, whether it was diagnosing lesions, looking at things under the microscope, dermatopathology, working with kids, working with the elderly. We do it all. And dermatology seems like, in many ways, like we're old-fashioned doctors who can offer immediate treatments to our patients and really reward them with something when they see us each and every time. I love being a dermatologist. And of course, I started to find out that there's a lot of people who want to harm dermatology, whether they don't want to pay us enough or they want to dismiss us or whether they want to move into our sphere of practice and pretend that they are us. We always seem to be under attack. And so I wanted to get involved in protecting the specialty that I love.
Terry, actually, on that note, maybe we can just jump right into one of the conversation pieces that seems to be a recurrent conversation piece almost every year. And thank you so much at the AAD for at least putting up a good fight for us each time, which is these cuts in reimbursements. And I say this in the landscape of the society where we have increasing overhead costs. I mean, the staff costs have gone up. And I don't know if you're aware, but in California, for example, our minimum wage for healthcare workers in a private practice has now increased. It's got a target of going to $25 an hour, which is a pretty big jump from where it was before. Not that we're paying minimum wage, but the point is that the overhead keeps going up. So can you speak to us about why is it that we have these recurrent Medicare cuts that come up every single year? And what is the approach that we've been taking? And how do we wrap our head around what ends up happening in terms of, whether it's cut or not?
Well, interestingly, I've been going to Capitol Hill for over 20 years. And every year we go up there to try to convince Congress not to cut us because built into the regulations, they have these cuts that they are planned to cut our fees. All right. It's just crazy. But what I didn't know until about 2.5 years ago was that every aspect of medicine, whether it's hospitals, nursing homes, inpatient, outpatient centers, all their payments are linked to inflation. So if inflation goes up, their payments from the federal government go up. The only ones in the entire healthcare industry complex that do not get an inflationary raise from the government are physicians. And once we realized that, and once
Wow.
inflation kind of heated up on us, I mean, it really took off in the last 3 years. It's become obvious that we cannot compete with other medical industries. We can't compete. Hospitals, when what they pay a nurse in the hospital, what they pay a medical assistant in the hospital is extraordinarily higher than minimum wage, okay? And they can afford it because they're paid extraordinarily higher than what we get paid. And it goes on year after year, and now it's obvious and we see it. And so we want that to be fixed. We didn't get it fixed this year. We have a lot of champions in Congress who understand it better. So the fight goes on, and we'll continue to keep fighting this issue. But it is patently unfair. And the people who are going to suffer are our patients because they're not going to be able to get access to physicians. And these are seniors we're talking about. And of course, all the other insurance companies, they're paid according to Medicare. So the system is breaking. It's breaking down. Whether it's purposeful or not is another conversation.
Terry, let me better understand what you're saying, because this is really an eye opener. So, we have the physician pool, and we're all like trying to see, like, whether this subset of physicians or that subset of physicians gets a cut, or, how it goes. But what you're saying is the physician pool does not get an inflationary increase as opposed to other pools where there's funding going from Medicare. Is that what you're saying?
Yes, your understanding is spot on.
Okay, wow. I didn't realize that. And so then we're kind of stuck with trying to figure out how to maintain our reimbursements. And then to fix that, our solution has typically been, well, let's see one more patient or two more patients. But that just in the long run clogs follow-up periods for patients. And of course, it's worse patient care at the end of it all.
Well, the patients end up not having enough time with their physicians. The physicians are burning out at record numbers now. When I first got started in dermatology, the idea that a dermatologist would be depressed or be suffering from burnout was laughable. We were the happiest doctors on the planet. We were happy to be dermatologists. We were happy to see our patients. We loved our work. I still love our work, but I don't want to see a million patients that are all mad at me.
Terry, one of the reasons I believe, and you've been a great leader on this, one of the reasons that physicians are kind of left behind and don't get that kind of increase compared to hospitals, nursing homes, other healthcare realms is our inability to work together. Can you talk about what is going on within the House of Medicine for doctors, and maybe just briefly go over your efforts, because you've been a real champion and a leader trying to get everybody together?
Well, thank you. It is disconcerting sometimes that you think that organized medicine should have it together. They should have it figured out how to lobby Congress, how to get things done. But what has happened, and I really don't mean to be dismissive or anything, but I went to the AMA meeting this year, and they do so much. They do an amazing amount of issue-related advocacy, but they're almost like they have ADD. They have 1,000 issues that are important to them. And everyone at the AMA is fighting over these 1,000 issues. Each and every one of them is important to them in a very visceral way. They're fighting for it. They're trying to get attention to it. But the reality is, if doctors can't make a living, you can't be involved in these social issues, And these social issues are great to talk about, but we cannot be fighting for social issues if we're not getting paid. So this year, we were able to organize our delegation to the AMA to focus the priority of the AMA on physician payment. And we were able to get a tremendous amount of people at the AMA engaged in this, and they were willing to take it to the highest levels. And the AMA really did a lot this year. And you may have noticed a lot of stuff on social media, the ads. They had ads in the airports in Washington, D.C. They really lobbied hard on this. I don't think I've ever seen them work as hard. They created neat videos to get the word out on how inflation was hurting physicians. They did a lot of stuff. And that I think that dermatologists can take a lot of credit for leading the way at the AMA in that regard. Another thing that we did is we felt that we had to organize medicine on this issue solely, this inflationary update, getting this inflationary update. And we organized a webinar with all the leaders of different specialties, whether it was family practice, the American College of Physicians, neurosurgeons, all doctors across the House of Medicine for a webinar on how to amplify our message, how to reach out to Congress, and how to do it in a lockstep way so that we're all saying the same message. And that's sometimes the problem, is that we're not saying the message, or we're fighting over the crumbs that they want us to fight over, and we're missing the big picture.
Yeah, exactly. I mean, that's kind of the takeaway that I'm thinking about. So can you summarize what the cuts were this year? And then how can we make a dent on trying to, rectify the ship and really fight for all physicians?
So, and I'm not certain that this is completely fulfilled yet, but we were to have a 3.25% cut across the board. And now the cut is going to be 1.68% cut. And it may change by the time this is being listened to, but basically we got less of a cut, but we're still getting cut. Again, this is in the inflationary environment I was talking about. So, this isn't a victory. This is not even something that we can hang our hat on and say, oh, well, it's not that bad. It's bad. It continues to be bad. There's no other job in America where year after year you do a great job and people cut your pay rather than give you a raise. And then we're expected to give raises to our employees. This is so patently unfair. It's unbelievable. And ultimately, it's going to hurt our patients.
Not to say the obvious, but for our listeners who may be out there and say, well, times are tough. There's inflation and the economy is not doing so great. And, doctors are actually making good money. And so they can kind of chip in. I think it should be clear that when you don't get an inflationary raise, meaning that the value of the money is going down, then as a clinician, you're actually getting paid less, which means that doctors are not seeking pay necessarily for themselves. They're looking for better pay for the whole practice so they can offer better services, hire more qualified people, forget more qualified, continue to have the people that they have and do the services that they have, because otherwise it's basically a pay cut every day as time goes by and inflation goes up and expenses go up. So I just wanted to drive that point because I think it's sometimes missed by people who may not necessarily kind of, follow economics or feel like I got $100 yesterday. What's so wrong with $100 a month from now? And no, it's not the same $100.
You're right on. And, it's very hard to play the fiddle for poor doctors. People don't feel sorry for doctors. They love their doctor, but they don't love doctors. They think that we're wealthy or overpaid or whatever it is. But I'm having trouble, and I'm a physician, I'm having trouble getting my parents to see doctors because I can't find a doctor who's willing to see them. So I'm not alone. I talk to people across the country. They're having trouble getting to see even a primary care physician, getting their parents to see a primary care physician. It's getting more and more difficult. And I think as this becomes more and more difficult, it's the patient voices that are going to make a difference. And I just want to reiterate that it's the patient's voices that matter, because I've been told by congressmen that Congress really doesn't care about physician opinions. They're dismissive of us. But our patients' voices matter because our patients are innumerable, and they are the voters. Those are the people we see, the people whose lives we touch. So it's really going to be reliant on us to mobilize our patients, the masses, the voting public, ultimately, if we're going to fix this problem.
Terry, you and Hadar, both of you guys brought up a really good point, which as a practice owner, I just want to also kind of emphasize that when the Medicare reimbursements go down, many of the other insurance plans are dependent on Medicare reimbursement rates. Like they benchmark off of that, whether it's a multiplier, whatever it is. So that means across the board, you're having some reduction. And I think maybe the notion that, that's less money in our pocket isn't quite the straight shot, because a lot of us are struggling to try to find ways to be appreciative of our staff and say like, oh yeah, you really do deserve a raise because you've been working pretty hard, or whatever it is, whether it's a nursing staff that's in their front desk, or gosh, like even the people on scheduling team, we're trying to keep staff with us and so that they feel appreciated too. So this really trickles down into more of a practice management issue where it's not money for us necessarily, it's money for those staff. And the bottom line is we still do some of those raises because we have to, like, find a way to appreciate our employees. And so then we do take a reduced pay. But, many of us refuse to do it at the expense of our staff because we know that they're really, really important to us. But it's just, it's too bad that we're put in that position that we have to make that decision. But of course, we're going to, try to support the practice. But like you said, it's the patients hurt, but also our staff. It's hard to find good staff, and we have to appreciate them. And so it becomes a challenge.
The system is ready to break down. You can see the writing on the wall. I don't know why Congress is blind. I have feelings that they actually want the system to break down. We'll get the blame for it being a broken system, and then we'll have a system like England or Canada. We won't have the wonderful system that we used to have.
Maybe we can kind of parlay on that to talk about another topic that kind of relates here, which is what can we, instead of talking about what's not going well, what are the things that we can do as a community right now, especially amongst the dermatologists? Or, what can we have our patients do that's going to help in this coming year and beyond?
Well, I think that if you want to be an advocate for physicians, an advocate for dermatologists, you have to make inroads with your congressional leaders. All right. You have to get to know them. So that means doing your best to go to their fundraisers, go to their meetings, meet with them, meet with their staff. One of the things that I always love to tell is that when my congressman was running, I have 3 sons, and my 3 sons, who were teenagers at the time, volunteered to work at his telephone bank during his election period. And they became like family to the congressman. When I need a congressional help, I can call my congressman and he knows me. He knows me personally because he knows my family. And those are connections that are not about money. That's just about time. And, time is money. But maybe sometimes you can get your kids to do it instead of you having to do all the work, right?
Yeah, no, absolutely. And I think it is important to really, actually, you bring up a good point of educating for advocacy. Seems like in the Cronin house, it grows right there as they raise you. That's fantastic. I did want to switch gears perhaps and talk about a topic that's somewhat related, and that's medical burnout. I know that's something that you care very much about. You alluded to that earlier, but perhaps you can tell us, how do you define medical burnout, and where do we see it in dermatology specifically?
Well, I think there was just recently a report from the AMA that showed that dermatology was, I think, in the top 6 for the worst burnout in the House of Medicine. I couldn't believe it. I think times have changed so much that for dermatologists to be thinking about leaving practice, retiring, so depressed they don't want to see patients anymore, these are the kind of things that are signs of burnout. No longer enjoying their work, no longer enjoying going into work. It's an ever-growing problem. They think it affects about 64% of physicians, right? 64% of physicians. And
Wow.
how do we get around it? How do we fix this? How do we improve that? Obviously, if you got paid more money, if you were more respected, if you were not treated dismissively, you'd probably enjoy your job a lot more, right? If you had the time to spend with your patients and give them the kind of care that you would like to receive, you probably wouldn't be feeling this burnout. And then the other thing that's always high on the list for causing burnout is our electronic medical records seem to drive doctors crazy. And I can understand why. A lot of them are just so horrible, and they're not intuitive. They're difficult. They make your life miserable. This is a real problem, and I don't have the answers on how to fix it. One thing I like to talk about is finding a creative outlet, something to kind of recharge your brain. A lot of people who are musicians, they're physicians and they're musicians, they come home and they play some music, and that kind of irons out the wrinkles in their soul, so to speak. Or other people cook, they get into cooking. They find a creative outlet. I like creative writing. That's something I talk about a lot. You can become a creative writer and author, and there's been a lot of doctors who've made a tremendous second career out of being an author. I think Michael Crichton is probably the biggest. He never really practiced as a doctor. He went to medical school and wrote his first novel in medical school, and he was off to the races. But there are a lot of dermatologists who've been authors, and there's an opportunity maybe to make some money doing it. But there really is a lot of research that shows that just by writing creatively, you kind of recharge your brain and you're less likely to succumb to burnout.
Well, you heard it here. Instead of J.K. Rowling, it's going to be J.K. Terry Cronin, right?
There you go.
maybe a good opportunity to mention Terry's book, right? You want to tell us about your book that you
Oh,
published
yeah.
together with, yeah.
Yeah. So during COVID, like it was a crazy time and everything kind of shut down. And I'm thinking, like, what am I going to do with myself? Well, I always wanted to work on a textbook of surgery, and I had my dad and my niece with me. And so we had the time to actually focus on putting together a textbook on the repairs after skin cancer surgery. And we made an atlas of anatomic reconstructive repairs. And so it's organized in different locations on the body. And we got several other dermatologists to each author a chapter. And it's just been really a thrill. It's been very well received. It just came out, and it's from Springer. And if you're at the Academy meeting, you can see it there at the Springer booth, but you can order it online. It's a fabulous book. And if you like dermatologic surgery after skin cancer treatment, after Mohs surgery, you'll love it.
Yeah, no, I saw that, and it's really cool. And a great opportunity to give a shout out to your niece, Dr. Cronin, who also trained at the University of Miami, and our department being the first putting cutaneous surgery in its name.
That's right. That's right.
That really closes a nice circle for us. I wanted to maybe end on a happier note. We talked about Medicare cuts and physician burnout. And it sounds like, my gosh, maybe some of
Are
the
we talking
medical
about
students.
food, Hadar? Is it going to be food?
Oh, yeah, no, not well. I'm going to leave it up to Terry, but maybe it is food. We talked about creative outlets. One thing for sure is cooking is an awesome way to do this and bring the family together. But I wanted to ask you, what would be your message, Terry, to medical students or even undergraduate students who are considering medicine and medical students going into dermatology? What excites you about the field in the future?
Well, I'm lucky enough that I do have some students who come through my office, and I always kind of give them the same kind of coaching. And one of them is going into medicine should be an adventure. If you're not having fun doing it, you shouldn't be doing it, right? It is an adventure. You learn so much about how to take care of people and how to help them. And so you become this incredible helper, and you're able to help people in ways that nobody else can because you're a physician. You can do that. And it's an adventure, and it takes you so many different ways. You find a little niche in medicine that you enjoy and that you want to learn more about and become an expert on. And next thing you know, you're teaching others about your level of expertise. And I think in dermatology in particular, our expertise is so interesting to those who are visual learners. If you're somebody who loves to look at art, if you're somebody who loves to watch movies, you're going to have a thrill learning about dermatology.
I love that. I mean, I think dermatology is so versatile, and we have so many ways that we can. I mean, despite all of these things we talked about today, I mean, dermatology really is like a dream come true in my eyes. And I think the fact that you've just mentioned, the many ways that you enjoy dermatology, it's just amazing. So I know a lot of people say don't go into derm or don't go into medicine. I still feel like we have such unique opportunities within medicine that even in this landscape, I think there's a way to really find a trueness to happiness. You just have to have a versatile kind of approach. I think if you do the same thing every single day, it can get monotonous, but we don't have to do that, just the nature of dermatology. I think we have a lot of opportunity with procedures or consulting or whatever it is, or becoming AAD president, Terry.
Yeah. And I'm just about to hand over my title to Dr. Simal Desai, and he's going to do an even better job than I did.
Well, okay. So, just to kind of wrap up here, do you have any thoughts to the future? Just, what makes you optimistic with the AAD and also for dermatology in general?
Well, the AAD is such a wonderful organization, and we have the most fantastic meetings ever where you can learn about dermatology, you can interact with your colleagues, and you know what? It's fun. And I think that's the most important thing to remember is that being part of the AAD is fun, but the AAD also has your back. When there's trouble, we have a staff who's going to look into what's going on in the government, and we work really hard to advocate on our behalf. Now, we're not a union. That's the thing. A lot of people think that we should be more of activists rather than advocates, but we are not a union, and doctors can't unionize in this current environment. Notice I said current, right?
Yes.
But I think the Academy is fun. If you love dermatology, there's no better organization. We are the largest organization in the world, and we're the lighthouse of education for our specialty. And so I think it's great. I think the future is bright for dermatologists because innovation is really at our fingertips, whether it's going to be artificial intelligence, whether it's going to be new technologies. All these things are coming, but I think it will only make us better dermatologists.
I couldn't have said it any better. And with that, Terry, we really appreciate your time with us. I know at the time of this recording, it's right before the big AAD meeting. So we know you're more than knee deep. You're probably head deep in meetings. And so we appreciate your time today.
No, I thank you. It's an honor to talk to you guys. Thank you so much.
Folks, I hope you enjoyed this episode. And if you enjoy learning about integrative dermatology, we want to fill you in on a little secret. It does not have to stop here.
That's correct. You should become a premium member.
A premium member? Hey, Raja, tell us, what does that mean?
Well, we have a private community at Learn Skin for practitioners who want to learn more and connect even more closely with like-minded colleagues.
That's correct. This is something that we have developed over the years based on what we wished we learned in training. Not only do you get a discount to the annual Integrative Dermatology Symposium, but you also get exclusive access to content that is not available to the public and a private online community to network and engage with.
So don't wait. Together, we can advance patient care. Join us as a premium member today, and let's get integrative.